Hey everybody, so we're trying to really capitalize on this idea of having a daily self-maintenance program, daily mobility program, having this idea of understanding that life is stressful, my exercise is stressful, my job might be stressful in some way, and I'm probably adopting a forward shoulder position. I'm slouching a lot, and I'm displaying that position chronically. That's where it becomes god-awful. And so I want to have this idea of, hey, if I can do something to help my body feel better, to have less pain through my shoulders, to have greater performance through my shoulders so I can be stronger. Everyone wants to be stronger. Everyone wants to have less pain. Everybody wants to be able to move more independently. Nobody likes being a slave to their own body where they can't do something like wipe their own ass because they're so freakishly stiff and they have so much pain in their shoulders and their lower backs and their hips that they can't do something so simple and basic for taking care of themselves. We need to be able to take care of ourselves better. And sometimes this can be like a long-winded routine that takes 30 to 60 minutes. Some people need that. And they need to be doing that every single day for a good long while until they're more out of the hole, so to speak. The deeper down the rabbit hole, the more work you have to do to get out of it. But sometimes we also just want to do something really quick and simple because maybe we have an outrageously busy day and we just want to be as effective as possible, get something in to help restore my posture, my position, my fitness, my healing, and help to optimize all these things. Really simple, especially for those of you that have a lot of slouching going on in your life. Massage therapy ball from your antecubital fossa. Did you like that? That's the elbow pit, the front of your elbow, working along your bicep, working along the front of your shoulder, the outside of your deltoid, and then getting into your chest, especially up into the upper chest, close to your collarbone. So the way I'm going to do this, really short and simple. I want to spend 2 minutes on one side, 2 minutes on the other, and then really practice having that good posture so that this can become normal again. But up, down, left, right, shear the skin all over the bicep. Ideally, do this on bare, naked skin as best you can. Move that all around. Now, typically, biceps are pretty easygoing. They don't tend to be super stiff and tight on most of the people that I've worked with in the past. So you can typically feel free to get the ball in there. Just watch out for getting to the underside of the bicep. That's where you find your brachial nerve and brachial artery pretty shallowly there. They're just right there. Doesn't take much pressure to get to them. Then getting into your chest, same thing, just simple massage. This isn't supposed to be complicated or complex at all. It's not supposed to be some kind of amazingly advanced program. It's about having this daily practice, this thing that you practice periodically all the time. It's meant to be super simple so that you actually freaking do it. Because how many of you are actually doing a self-maintenance program? If not, start one, just do this, 2 minutes, massaging out your pec. So massage out pec and shoulder for 1 minute, pec for another minute, and then do the other side, same thing. When you're doing your pec, you also want to really focus on getting to the underside, as if you're trying to get between the pec and the rib cage. This is going to do a lot to free up your circulation so you can have better blood flow, better lymph flow, which means you're going to have better immune system function, which means you're going to heal better. If there's any pain down your arm or down in your abdomen, this is going to help out massively. And that's going to help you to be a lot stronger as well. We all want to be a lot stronger. We all want to have a lot more performance. We all want to have more independence in our own body. So do that, 2 minutes on the other side. Simple, easy. If you suffer with chronic pain, chronic injuries, athletic injuries, I have got you covered. My name is Ethan Hammond, and I am a strength and rehab specialist. I work with people who want to return to sport and fitness, but feel that they can't because of pain and injuries. I've helped people with conditions such as lower back pain, ACL tears, shin splints, neck pain and chronic headaches, and so many more things. Now, a lot of you will be going through things like this, like what I just listed above, and you're saying that you cannot train anymore. Bullshit. You have got to train, and you've got to train right. Train or complain, that is the way this works. Now, I work in person in Southampton, England, but I have online services as well if you're a bit further out. And I also offer free consultations to get you started with a free game plan and strategy for getting out of pain. All you have to do is to send me a text or a WhatsApp message to 07 305 231 339, and I will personally get back to you in the next 24 hours to get you started on the road to proper recovery. If you are serious about leveling up and making real change, this is how you start.